A common hearing problem gets some attention this week. Specialists want people to know more about tinnitus.
Photojournalist Gabe Zerzinski spoke with a local audiologist from ASI Beltone about what tinnitus is and how to manage it.
So this is an audiogram, and what it represents is it goes low to high pitches as you go across the bottom here.
A lot of times what happens is because you have a loss in hearing, your brain tries to fill in the blank of the information it's no longer getting. And that fill-in is the noise. And we say tinnitus, and a lot of times you'll go to an office and they'll say, do you have ringing in your ears? But it can be ringing, it can be crickets, it can be bells, it can be lots of different sounds that patients might experience. And in the office here, when people come in, the first thing we want to do is when they call and ask about it, things like that, is we want them to get a hearing evaluation to find out if there's a hearing loss. And a lot of times, not in everybody, but in the majority of people, if they treat their hearing loss, a lot of times that will help reduce some of that tinnitus or ringing sound that they're experiencing. Hearing loss most of the time is managed, and we do that through hearing aids, through those types of devices. Now those have gotten dramatically better over the years. There's been significant advancements in technology, that sort of thing, but a lot of it depends on the amount of hearing loss, the configuration of hearing loss, how long you've gone without doing anything about the hearing loss. All are factors in success rate in the long run.
Now neurologically it's a little more complicated than that, but it's basically the brain.
When you go to a concert and you hear that ringing sound, you've actually damaged your hearing a little bit. And your hearing gets a little bit worse, and then it goes back to normal, but it doesn't go all the way back. There's a slight difference. And a little tiny bit of hearing loss occurs. But over time, those little tiny changes start to build up and become a more permanent hearing loss, and then the ringing stays. It doesn't go away anymore. So protect your hearing as much as you can.
The perception of it, we can't.
Avoiding prolonged exposure to loud noises and wearing hearing protection are the #1 ways to prevent hearing loss and tinnitus. If you are struggling with it, make sure to see a professional and get a hearing evaluation.
Mineral policeman